The U.S. is making major strides in its coronavirus vaccination efforts just in time for the holiday weekend. 40% of the population is now fully vaccinated, and nearly 50% have received at least one shot. Infections are also trending in the right direction, with rates slowing down more than 90% since the start of the year. But experts still warn that it's too soon to say that we've actually beat the virus. Meg Oliver has the latest.
Tonight, the crowds are coming.
I think everybody's just got cabin fever and they can't wait to get out.
The U.S. is now averaging fewer than 22,000 new cases a day, a 92% drop from January's peak when more than 300,000 new infections were reported in a single day. But Dr. Anthony Fauci warned today it's too soon to declare victory.
We can't be complacent about this until we've essentially gotten the level of infection dramatically lower than it is now.
Vaccination rates have fallen by more than half since April, but there was renewed interest after the CDC updated its mass guidance. Traffic to vaccines.gov grew by 23% that week. Incentives also helped, like Ohio's Vax-A-Million sweepstakes. One of the first fully vaccinated winners says she's still in shock of becoming a millionaire.
It was a Wednesday night that I'm never going to forget.
Not to be outdone, tonight, California unveiled the nation's biggest vaccine jackpot. 10 state residents will each win $1.5 million. More than 40 states have already lifted mask mandates. California will lift theirs in mid-June, Massachusetts on Saturday, and tomorrow masks come off in New Jersey, where crowds are expected to bombard the beach, and business owners are scrambling to hire workers.
I think it's just there's so much competition for the same person.
Tim McClune owns 9 restaurants at the Jersey Shore.
A total alternate job showed up: DoorDash, To Go Dining, Uber, Lyft, all these companies that hired people mostly between the ages of 18 and 25, let's say.
That's your biggest competition?
Yeah.
As businesses struggle to hire seasonal workers, some are offering incentives like accommodations and hiring bonuses. Here at McClune's, they'll stay open around 60% capacity until they fill all of their spots. Lana?
Really great to see those vaccine lottery winners. All right, Meg, thank you. And Dr. Taison Bell joins me now. He is a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Dr. Bell, always great to have you on the show. So let's get into the latest of the numbers. 4 in 10 people in the U.S. are now fully vaccinated. So what are the biggest obstacles right now in the country's vaccination efforts and our overall efforts in really beating this pandemic?
Well, vaccination really is the way out of the pandemic, and we've seen how widespread vaccination has led to this decrease in cases that we've seen, over 90% over the year. We still have pockets of the country, however, that still have relatively low vaccination uptake. So this next and hopefully last phase of the vaccination campaign is reaching out to these areas, making sure that we have great access, good education, and try to get over that hurdle to get the highest level possible of people vaccinated.
And we've also heard experts say that it's likely we'll need booster shots in the future, but a timeline for that is still a big question mark. So what needs to be understood before we can really have a better picture of what these booster shots would entail, when they would happen, and who would need them?
That's a really good question, because this has been something that a lot of public health experts, immunologists have been wondering about. Now, we know that after vaccination or infection with COVID-19, your antibody levels do eventually decline over time. But what we don't know are the other parts of the immune system that have a role in maintaining some of that protection. So there have been 2 interesting studies that have come out recently that have looked at what's called the cellular mediated responses. These are the cells that actually produce the antibodies and the cells that help signal those cells to make antibodies. We really haven't had the ability to study these in great detail, but what it looks like is after infection with COVID-19, you do have what's called durable immunity that can last up to a year, meaning that even if those antibody levels are on the lower side, you may have that ability to make those antibody responses if you were later reinfected with the vaccine. It's kind of like a password that you have for your computer or your application. As long as you know where it's stored and you have that easy access to it, you don't have to keep that password out in the open all the time. So now that we're starting to understand this a little bit more, that might add to our understanding of who might need vaccine boosters and when, and whether we're targeting the original version of the coronavirus or if we need to specifically target some of these variants that have been circulating.
Let's circle back to the origins of the coronavirus, because the U.S. intelligence community says it does not know, quote, where, when, or how the coronavirus was initially transmitted. And we just heard from the Biden administration that they're giving them 90 days to redouble their efforts in investigating the origins. If you would, please remind our viewers, what are the likely scenarios, and why is it important to determine where this virus actually originated?
Well, just like what happens in the hospital where I work, if there's something that happens, that you need to understand the original cause of it so that you can prevent it from happening again. In this case, we have a virus that has caused a worldwide pandemic, and millions of people have died. Unfortunately, we really have to understand the origins of it, whether it happened from an animal market and a spillover event, or if it escaped from a lab. Now, this was discussed earlier on in the pandemic, and it doesn't appear that there's any new information to suggest one way or the other, but it's a real effort to truly understand what are the origins of the SARS-CoV-2 vaccine. What we have to be careful of course, is that we don't attach this in any way to stigmatize Chinese Americans, Chinese citizens, or Asians in general. We've seen a rise in anti-Asian hate, and to be frank, a lot of the flames were fanned by the former commander-in-chief. So we do have to do a thorough and proper investigation, but we do have to do it in a way that does not stigmatize others.
A very important and humane reminder. Last time you were on the show, Dr. Bell, we were talking about how well we're doing in the United States in terms of vaccinations, and that the rest of the world wasn't necessarily at the same place that we are. And now we're looking at the Olympics just 2 months away, and we're hearing from the head of the Japan Doctors Union warning that these Olympic Games could actually lead to an Olympic strain. And athletes are being encouraged but not required to be vaccinated. We're also hearing from the New England Journal of Medicine, which warns that some athletes may choose not to become vaccinated because they might fear that it would affect their performance. So what is your take on all of this? Is there a safe way for the Olympics to continue as planned?
Well, I must say that I've shared those concerns, and I think at this point, I don't see a way that this can be done safely if you look at some of the conditions on the ground in Japan. So we know that Japan has had relatively low rate of infections with COVID-19 compared to other developed countries. And a lot of that has been due to good adherence to public health measures, and they've been very restrictive with travel. Now, because of that, there has not been a lot of urgency to vaccinate, and they have very low rates of vaccination. So, for instance, 3% of the population have received at least one dose, 1% fully vaccinated, which is the worst out of all developed countries. Now, on the other end, we also know that there's a high proportion of Japanese citizens who are at or over the age of 65%, about a quarter or so. And now we're talking about having thousands of people come into the country without a requirement that they're vaccinated. That's very, very concerning. And I share those concerns. And I would encourage people to look at moving these events and postponing them.
It's so difficult because you see these Olympic athletes, these Olympic hopefuls, and they have been working so hard for so long towards this goal. But if there is a potential for a super spreader event, how might that impact our global efforts against this pandemic?
Well, any setback in a country is a setback for the world. And we've seen with super spreader events that there's a potential to develop new variants. And of course, when people are coming from different corners of the world, they eventually go back home. And so we have an opportunity for the virus to really spread around the globe if there's a new variant, to circulate very widely and easily into other communities. And so we have to be very careful, understanding that people invest a lot of time and effort into the Olympics. I just think at the end of the day, public health and safety has to come first in this instance.
All right. Dr. Taison Bell, thank you for being here, and thank you for all that you do.
Thank you.